and prefer part of Bangladesh come here. I would like to say something about collaboration between pulmonologists and oncologists. It is a realization of collaboration. You all know that lung cancer is the highest incidence rate. It is most common cancer in Bangladesh and worldwide. Most common cancer. Most common. It tumor itself destroys the lung by its local effects. It also destroys lungs and other tissues by liberating some chemokines, tumor necrosis factors, and others. So it affects in various ways. Please listen to me. Why we should tackle, why there is a need for robust partnership, as because lung cancer destroys the lungs, as occupant Israel are destroying the Gaza. There is then hospital data records from Bangladesh National Institute of Cancer Research Hospital. It's most common cancer, I already said. We can categorize the effects of lung cancers in various ways. These are some pictures. Cancer therapy can also destroy the lung, can cause injury to lung. Here are some examples and impacts of tumors and cancer-related therapy on respiratory systems. We can categorize in this way: tumor-related airway disease that causes airway stenosis, tracheoesophageal fistula, and causes chest infections, recurrent chest infections, poor quality of life. Tumor-related vascular disease, and it causes pulmonary embolism. It causes hemoptysis, chest pain, that may hamper your treatment. Tumor of mediastinum and pleural disease. As you know, it causes effusion, respiratory lung disease, and so on. Tumor itself and tumor-related, treatment-related lung injury. Chemotherapy, immune checkpoint inhibitors, as already mentioned. Radiotherapy can cause lung injury, and it causes dyspnea, chest pain, and even surgery can cause lung diseases, can destroy or can injury to lung. Why we should, I say this in this way, because pulmonologists should come forward. Pulmonologists should take in every categories, every impact of categorization, they have a role. That's why there is a publication in Indian Journal of Pediatric Medicine Pediatric Oncology 2020, the pulmonary oncology scope of pulmonologists. The future scope is huge and limitless, as they said. If we say in specifically, a pulmonologist must evaluate the cancer mimics symptoms and radiological mimics also. They should collaborate with oncologists to treatment pulmonary comorbidities. Patient may have lung cancer, may also have COPD, may also have asthma, may also have ILD, ABP, and other diseases. to diagnose and stage lung cancer. As you know, pulmonologist has a role. In critically ill patients, in ICU, they should come forward. As an interventional pulmonology has another important role in both diagnostic and therapeutic. As you all know, to collect samples by flexible bronchoscopy, medicinal lymph node and massage analysis, peripheral pulmonary lesions evaluations, and so EVAS and central airway disease scope is here to treat central airway disease, balloon dilatations, organ plasma coagulations, cryotherapy, debulking, laser, and so on. Stenting for dynamic therapy also. Pleural disease, the malignant pleural effusion, very much devastating conditions. This publication was published is an open access journal. They need for a pan-oncology respiratory discipline also. Pan-oncology discipline. Pulmonary oncology discipline should a next subject. So it is need for pulmonary oncology collaboration for early management. I say something about my experience from Sher-e-Bangla Medical College. It is patient Farooq Khan. It is a case of COPD. After a few years of patient developed hemoptysis, chest pain, and diagnosed as a case of squamous cell carcinoma. Patient is COPD. After that, patient diagnosed case of squamous cell carcinoma treated accordingly. Patient again developed hemoptysis, fever, weight loss, and diagnosed case of pulmonary tuberculosis, sputum positive. Patient initially was in Sher-e-Bangla Medical College. We referred to Dhaka. They are treated, and they again referred to as a pulmonologist for cancer, for tuberculosis treatment. And another tale, Abdul Razzaq, is adenocarcinoma patients. After treatment started, few days, patient developed respiratory failure and admitted in our hospital ICU. We treat accordingly. As patient has COPD, patient developed type 2 respiratory failure, we use BiPAP and patient ultimately salvaged. Another tale, this is Abdul Razzaq also. After treatment of chemotherapy, patient developed diffuse lung disease, ILD, and we treat the patients and salvage life. I conclude that lung cancer is leading cancer in Bangladesh, and it is a global crisis as well. We need a collaboration if there is collaboration between pulmonologist and oncologist, treatment will be optimum and we can save mankind. Thank you.